Let me talk about the mediastinal lines and strips. Before I talk about the mediastinal lines and strips, you can see here, this is the image of the lung. This portion is a posterior part of the upper lobe, and this portion is the anterior part of the upper lobe. And you can see there is an empty space anteriorly as well as posteriorly, and it is in the mediastinum, because the central part will be the mediastinal part. And this part which you see here, this part which you see here is the anterior junctional line. This anterior junctional line is formed when two lungs come close in front of anterior mediastinum. So you can see here the two lungs are the two edges of the upper lobe. They come in contact with each other anteriorly, leaving a intervening area in between. And this intervening area which you see here is called anterior junctional line. And this anterior junctional line contains some mediastinal fat, and this does not extend above the manubrium sternal junction. Now let us talk about the posterior junctional line. So posterior junctional line is formed posteriorly. This is the posterior part of the lung where the two upper lobes come in close contact with each other, forming an intervening area, this area. And this area, this space is in front of vertebral column but behind the esophagus. And this intervening area, that is the posterior junctional line, also contains some mediastinal fat, and this posterior junctional line extends from third to fifth thoracic vertebra. So from third to fifth thoracic vertebra it extends. Now if I show it on the X-ray, as I said that this is the anterior junctional line, this is the posterior junctional line. So if you see here, the two lungs come close to each other anteriorly, and as I said that it forms a vertical slit-like appearance, or it forms a vertical intervening area which is called as anterior junctional line. This anterior junctional line can be shown on the X-ray is here, where the two lungs, so two lungs, this is one lung, this is another lung, the upper lobes of the two lungs come closer to each other anteriorly, forming a vertical line. But this is not absolutely vertical, it is slightly oblique, this line. And if you see here posteriorly, as I said that this is the posterior junctional line which is formed by the when the upper lobes come in close to each other in front of vertebral column and behind the esophagus. And you can see it on the X-ray here that this is the posterior junctional line which is formed when the two lungs come closer to each other posteriorly. So you can see here the two lungs coming closer to each other, and this can be shown on the X-ray here. This is the anterior junctional line, you can see these are the two lungs here. This is another lung, and this is the anterior junctional line. So this, as I show it here, this is the anterior junctional line, which is shown here on the X-ray. And if you see the CT scan, these are the two lungs. When two lungs come closer to each other anteriorly, they form anterior junctional line, which is filled up with mediastinal fat. I think that is clear. Here it can be shown, you see the this line, the anterior junctional line, as I said, it is not absolutely vertical. It is slightly oblique. So you can see here that this is a oblique line, you can see here, which is anterior junctional line, and you can clearly see that this anterior junctional line does not extend above the clavicles, or it does not extend above the manubrium sterni. I can show it here in a magnified way. This line, which is slightly oblique, which you see in the mediastinum or in front of the vertebral column shadow, this is anterior junctional line. You can clearly see here this one. This is anterior junctional line. This is this line, anterior junctional line. If I show it here, this oblique line on the X-ray, what is it called as? Yes, this is called as anterior junctional line. And this anterior junctional is slightly oblique. It does not extend above the clavicles. And what you see, there is another line here, this line. Okay, I will come to that in another image. Now what is happening here, you see this is the oblique, slightly oblique. This is the anterior junctional line, but it is not on the center of the shadow of vertebral column, so it is displaced. So this is number one. This is anterior junctional line, which is slightly oblique, which is displaced, and is thickened. You can see this is thickened here. The previous X-rays, in previous X-rays, the anterior junctional line was not thickened. And the line you see here, you see there is another line, another vertical opacity or another vertical line. This line is called azygos. This is formed due to azygos vein. Is that clear? Yes. Now if I show here again, as I said, this is anterior junctional line. This is posterior junctional line. So posterior junctional line extends above the clavicle. So you can see it extends above the clavicle. The anterior junctional line does not extend above the clavicle. And it ends, the anterior junctional line, it almost ends at the azygos vein. So this portion here is the azygos vein, right? It ends near or at azygos vein. So you can see here this portion. This portion is the azygos vein. And this is anterior junctional line. Now if you see here this line, which is seen through the tracheal air column, but this line, it extends above the clavicles. So this line is the posterior junctional line. So it is this line, the posterior junctional line. So it is clearly seen here. Now in this radiograph, you find that this oblique line, we all know now, this is anterior junctional line, which ends at or near the azygos vein. that is here, and there is also a vertical line here which extends above the clavicle through the center of the tracheal air column, and this is called as posterior junctional line. So this is the posterior junctional line. As I said, that posterior junctional line is formed by the upper lobes posteriorly in front of vertebral column, and anterior junctional line is formed anteriorly when two upper lobes come in close contact with one another anteriorly. I think this is now clear. So again, let me show it here. This is the posterior junctional line. You can see it is extending above the clavicle, and it starts from the arch of aorta. This is the arch of aorta. It starts at the level of arch of aorta. And you can see clearly these are the two lungs here, one lung. This is the another lung here, right? So posteriorly, when these two lungs come closer to each other, they form the intervening area, forming a thin line or an opacity, which is called as posterior junctional line. Now in this picture also, you can see here the posterior junctional line, which is a linear opacity, which extends above the clavicles, and you know how it is formed. Now coming to right and left para-tracheal lines. In this image, you see, if you take this image, you see there is a linear opacity. This linear opacity we will be seeing on the radiograph. So on either side of the trachea, there is a linear vertical opacities on either side of the trachea. But here it is thickened. So in this image, you find thickened right. On X-ray, we see it as an linear vertical opacity in the form of a line. A vertical line will be seen on the sides of the trachea. So we can see it here. There is a vertical opacities like this. You can see vertical opacities like this, linear vertical opacities on the sides of the air column of the trachea. So this side also you can see here the vertical thin lines, and this will be the right para-tracheal line, and this will be the left para-tracheal line. The right para-tracheal line, which is this line, is formed between the right upper lobe. So this is right upper lobe and the right lateral wall. So this is the right lateral wall of the trachea. So between the right lateral wall of trachea and right upper lobe, there is an intervening area which is filled with the mediastinal fat. So this forms a vertical opacity or the line, and this vertical opacity or the line is around 1 to 4 mm in thickness, and it extends from, you can see here, it extends from clavicles to the right tracheobronchial angle. So this is tracheobronchial angle. That means where the trachea divides into the right bronchus and left bronchus. So it extends from the clavicle up to the tracheobronchial angle. So this is here, and ends also at or near the azygos vein. So this vein, what you see here, the circular opacity is the azygos vein. And we must also know that this line never extends below the bronchus. So you can see here, this is the bronchus, this is the right bronchus, this is the left bronchus. So it doesn't extend down to the bronchus. It rather ends near or at the tracheobronchial junction. That is here. Now, if I show it here, this right paratracheal strip or para-tracheal line contains right tracheal wall. So it includes right tracheal wall. It contains fat. It contains nerves. It contains lymph nodes, and it also contains the pleura of right upper lobe. So this is right upper lobe. It will be covered by the pleura. So pleura forms the part of right paratracheal strip or right paratracheal line. As I said that this right paratracheal line is formed by the right lateral wall, fat, nerves, lymph nodes, and pleura of the right upper lobe. You can see here, this is the right paratracheal strip or line, and it goes down up to the tracheobronchial junction and ends near or at the azygos vein. So this is the azygos vein here, this part. It can be seen here on the X-ray here. Exactly now shown very clearly here. And as I said that it should be around it should not be more than 5 mm. If it is more than 5 mm in thickness, then it means it is thickened. It should be less than 4 to 5 mm. Now coming to the left paratracheal line or left paratracheal strip. So this line what you see here is the left paratracheal strip or paratracheal line, and this opacity or this area left paratracheal strip is the intervening area between the air column in the trachea and the left upper lobe. So it includes the this left paratracheal strip includes left tracheal wall, it includes the pleura, and it includes the intervening mediastinal fat. One should also know that the left paratracheal strip varies in thickness. This left paratracheal strip varies in thickness as in like a right paratracheal strip. It contains fat, it contains lymph nodes, it contains left upper lobe pleura. I think that is clear now. Yes, it should be clear. We also know that the left paratracheal strip, so this portion is the left paratracheal strip. It extends upwards, so it extends from here, it extends upwards from the aortic arch. So it is aortic arch here, so it extends upwards from the aortic arch to join the shadow of left subclavian artery. So here will be the left subclavian artery, this portion. So it is here the left subclavian artery. So here up to this level, the left paratracheal strip is seen as far as radiograph is concerned. You can see here, so I am saying that Left paratracheal strip extends from the aortic arch. It extends up to the left subclavian artery, that is here. I think that is clear now. So the left paratracheal strip is seen less frequently. So you more often see right paratracheal line or strip, and you less often see left paratracheal strip. The reason is that it is obscured by the left lung or by the common carotid or left subclavian artery. I just showed in the previous radiograph the position of the left subclavian artery. So this left paratracheal line or left paratracheal opacity, which is a linear opacity, may be obscured by the left subclavian artery, common carotid artery, or the left lung. That is why we don't see it often. The paratracheal strips may show abnormal contour or widening. Sometimes they are widened. So we can easily now make out why they should be widened or why they should change their contour of the shape. That can be due to large pleural effusions, paratracheal lymphadenopathies, neoplasms, or mediastinal hematoma. That are some of the reasons in which the paratracheal strips may change in shape or may change in thickness. Now let us talk about paraspinal or paravertebral lines. The paraspinal or paravertebral lines are seen along the lateral margins of thoracic spine. So this is the thoracic spine, and on the lateral margins, that is on left side as well as on right side, and in close proximity to the spine, you see the vertical opacity, light opacity, which runs vertically alongside of vertebral column, both on right side as well as left side. These vertical opacities are called paraspinal or paravertebral lines or strips. You can see here, this is on the right side, this shadow, white shadow. This is on the left side, and these strips are filled up with mediastinal fat, lymph nodes, intercostal veins, and pleura of the lungs. And it should be less than 1 centimeter in width. If you see here, we see a vertical opacity which runs alongside the vertebral column, and we clearly see it on the left side in close proximity to vertebral column. And on the right side, this shadow is not clearly seen or is not seen at all. This is because of the patient may have less fat in the body. That is why you may not have this line alongside the vertebral column. So the thickness of this depends upon the fat. So in obese people, we see very clearly this paravertebral line. Now if you see lateral to this paravertebral line, you see another shadow coming here downwards. and this shadow is aortic shadow. So this shadow, which is lateral to paravertebral line, is the aortic shadow. The right paraspinal or paravertebral strip runs from 8th thoracic to 12th thoracic vertebra. So you can see here on the right side there is a shadow, this shadow, there is a shadow clearly seen alongside the vertebral column. This is the vertebral column, these are the borders of the vertebrae, and lateral to it on the right side there is a linear opacity. So on right side it runs from 8th thoracic to 12th thoracic vertebra. And if you see on the left side also, this strip is seen very clearly, and this runs from the level of aortic knob or aortic knuckle and downwards to the diaphragm. So on both sides of the vertebral column, you see the right paravertebral strip and you see the left paravertebral strip. So I should say here that it is mostly the left paravertebral strip that is often seen, and you may not see in many x-rays the right paravertebral strip, or in some x-rays you may see both or you may not see both these strips, or you may see only one strip. And as I said that thickness of these strips depend upon the content of fat in the body. Let me show it here again. This is the left paravertebral strip, light opacity alongside the vertebral column. Sorry, this is the left paravertebral strip, and this is the right paravertebral strip. You can clearly see this line here, and on the lateral side of this line, that is this line, is the shadow for descending aorta. Now if you see here, this line is clearly seen on the left side of the vertebral column. As I said that this is the left paravertebral strip or left paravertebral line, and on the right side we don't see it. So here again, left paravertebral strip, and this is right paravertebral strip. Here also you see this shadow here. This is left paravertebral strip, and lateral to this, that is this shadow which is coming from here, is the shadow for descending aorta. You can see this light white shadow coming here, and it is this lateral to this left paravertebral strip, and this shadow is due to descending aorta. So as I said that with little fat the interface may not show the strip. So if you see here on the right side, we don't see clearly this paravertebral or paraspinal strip. But if you see on the left side, it is clearly seen here the left paravertebral line or left paravertebral strip. As I said that thickness of it depends upon the content of fat in the body. So in obese people, you may see this clearly. Now, widening of paravertebral line may be due to lymphadenopathy, pleural thickening, hemorrhage, fluid, or injury to the descending aorta. So you can see here on the left side there is a bulging of paravertebral line. So this bulging is seen here on the left side. You can see here the paravertebral bulge, which could be due to any aortic injury, which could be due to pleural thickening or lymphadenopathy. Now coming to azygos-esophageal recess or azygos-esophageal line or strip. Now before I show it on the X-ray, let me first explain here. Here, this is the azygos vein, which is over and in front of vertebral column. And here you can see this azygos vein runs vertically over the vertebral column, and it extends from the azygos vein arch. So this is azygos vein arch here. Then it courses slightly obliquely, then it goes vertically downwards below the hiatus, below the aortic hiatus. So you can see clearly this is the azygos vein. This is the hemiazygos vein here, and here they unite to form the azygos vein. The azygos vein may also receive the accessory hemiazygos vein. So this is left hemiazygos vein, this is right hemiazygos vein. Two unite to form the main azygos vein, and this azygos vein then ends up in the azygos, in the arch of azygos vein, and then to the superior vena cava. This azygos, so here also on the front of vertebral column there will be esophagus also. So we know it that in thorax, in front of vertebral column will be also esophagus. So both these esophagus as well as azygos vein, they throw a shadow or the shadow on the chest x-rays. So we call it as azygos-esophageal line on the x-ray is thus a boundary or demarcation between the right lung. So this is between the right lung or right lower lobe, and that is that the right lung will be on the lateral side of this azygos esophageal shadow, and there will be the azygos vein which will be medially, and this forms the boundary which is seen on the X-ray as azygos esophageal line. Now if you see here, this is the contrast film in which you see the azygos vein. So this is the azygos vein in front of vertebral column. As I said that it extends from the azygos vein arch. So this is azygos vein arch, and it is slightly obliquely above. You can see it, and then it runs vertically downwards over and in front of vertebral column. I think it is clear now. So I show it here again. The azygos vein extending from azygos vein arch goes over and in front of vertebral column. The superior part is slightly oblique. So this can be shown on the plain X-ray here. So this is the azygos vein arch, and this is the azygos vein which runs over and in front of vertebral column. So I think this is clear. Now if I show it here, so you can see here this line or this strip. You can see this line or strip here. This is called as Azygos-esophageal line or Azygos-esophageal recess. And as I said that it extends from azygos vein arch. So this is the azygos vein arch here. So azygos vein arch is here. And azygos vein then ends up in the superior vena cava. In this X-ray, you can also appreciate this shadow. This is the para-aortic shadow. This is the shadow of descending aorta. And if you see in between this line, as already said that this is a paravertebral line. So lateral to paravertebral line is descending aortic shadow, and this over the vertebral column is the azygos esophageal line. I think it is very clear now. So the abnormal appearances of azygos esophageal line may suggest diseases like esophageal diseases and hiatal hernia, lymphadenopathy, bronchopulmonary foregut malformations, pleural abnormalities, and left atrial enlargement. Now let me again explain it here. This is the azygos esophageal line which runs over and in front of vertebral column. The superior part of it is slightly oblique, extending from the azygos vein arch. So it is shown here. This is the azygos vein here, azygos vein arch. And if you see here in this, there is this line over the vertebral column, this line here. Yes, you can see it clearly. This line ends up in the azygos vein arch, and from the azygos vein arch it goes to superior vena cava, and you can see it is slightly oblique here, then it runs vertically downwards. Now let us talk about aortopulmonary window. The aortopulmonary window is seen on the PA view of chest X-ray as concavity. So you can see here the concavity which lies between the inferior border of aortic arch. So this is inferior border of aortic arch. So it lies between this and left pulmonary artery. So this yellow line is the left pulmonary artery. So the aortopulmonary window is an area that lies between the inferior border of aortic arch and left pulmonary artery, and this is concave in shape. If you look here, this is the aortic knob and this is the pulmonary artery. So between the pulmonary artery and the inferior border of aortic arch is this area which appears to be concave, and this area is called aortopulmonary window. This can be seen here also. This is the inferior border of arch of aorta, or the inferior border of aortic knob, and this is the pulmonary artery here. So between the pulmonary artery and the inferior border of aortic knob is the concavity, which is called as aortopulmonary window. We can see it here also. This is the inferior border of aortic knob. This is the pulmonary artery. So this area will be called as aortopulmonary window. Let me show it here also. This is the inferior border of aortic knob. This is the pulmonary artery, and between these is the aortopulmonary window. Now, if you see here, as I said, that aortopulmonary window should be concave, but here we don't see it concave. We see it. We don't see any concavity here. We rather see convexity. So that means the pulmonary artery is either dilated or there is aneurysm in the pulmonary artery. So most commonly it happens due to the pulmonary hypertension, in which pulmonary artery gets dilated. The pulmonary artery, which is also called here in this area as pulmonary conus. So this pulmonary conus has become prominent. So the concavity is changed into convexity, which can happen in pulmonary hypertension due to various causes of heart disease. It can be nicely seen here. We don't see any aortopulmonary window. Instead, we see that this area has become convex, and the pulmonary conus, that is pulmonary artery, has become enlarged, has become prominent. So this could be due to pulmonary hypertension secondary to various heart diseases. Now let me come to aortopulmonary strip or line. So this is actually uncommon feature of frontal chest X-ray, and this demarcation or this line or this strip is formed by the left lung when the left lung comes in close contact with aortic arch and pulmonary artery. So they form a boundary there. There is a demarcation line created when the left lung comes in close contact with aortic arch and pulmonary artery. So it will be from, and this extends over the aortic arch and pulmonary artery. So if you see here, this is the aortic arch here. So it extends from the aortic arch to pulmonary artery. So from here to here, and it is mildly convex, and it is also somewhat oblique. You can see this line here. As I said, that this demarcation line is formed by the left lung when left lung comes in close contact with aortic arch and pulmonary artery. So you can see it here also. This is the aortopulmonary strip, and this aortopulmonary strip extends from the aortic arch to the pulmonary artery. Below the pulmonary artery will be the left atrium. Now let me talk about the posterior wall of the bronchus intermedius or posterior tracheal strip. So before I make you understand what the posterior tracheal strip means, let me talk about something about the trachea and the bronchi. So these are two main bronchi, right bronchus and left bronchus. And this right bronchus, it divides into upper lobe bronchus and bronchus intermedius. So this is the bronchus intermedius here, and this bronchus intermedius then divides into middle lobe bronchus and lower lobe bronchus. So the bronchus intermedius is the area between the upper lobe bronchus and middle lobe bronchus. So as I said that the main right bronchi divides into upper lobe bronchus and bronchus intermedius. So this portion is bronchus intermedius. So this bronchus intermedius then divides into middle lobe bronchus and lower lobe bronchus. And this bronchus intermedius is the area between the upper lobe bronchi and the middle lobe bronchi. So this area. So when we see this area on the lateral film, this area appears as thin vertical opacity. So you can see here the thin vertical opacity here and here, enclosing the air column of the trachea. This is trachea, and this opacity, this linear thin opacity, which is about 3 to 4 centimeters long, and the width of this is around 0.5 to 3 mm in thickness or in width. So it should be around 0.5 to 3 mm in thickness, and this should be long between 3 to 4 centimeters. So this is how the posterior how the posterior tracheal strip appears on the lateral wall, or how the bronchus intermedius appears on the lateral view of the X-ray. And if there can occur an abnormal thickness. This vertical lines, this vertical opacities can become thick whenever there is pulmonary edema of various causes. So this was about posterior tracheal strip or bronchus intermedius appearing on the lateral view of the X-ray.